Meet Sarah, a 54-year-old woman who has noticed that she is increasingly out of breath over the past 4 months. At first, it was only noticeable during intense exercise, but now she can barely walk upstairs or keep up with daily activities. Curiously, she mentions that she has slept on her recliner in recent weeks because sleeping in her bed would cause her to become so out of breath that she would wake up gasping for air. She then shares that she has a history of high blood pressure, diabetes, and coronary artery disease. Suddenly, the pieces start to click. So, what happened? When a patient has high blood pressure or hypertension, the heart needs to work harder to maintain constant blood flow to the body. This is what we call cardiac output. You can think of this like rolling a boulder instead of a basketball up a mountain. The thing is, the heart is a muscle, and like any muscle, it makes gains. This should be a good thing, right? Well, not exactly. As the heart thickens, there is less and less room for blood to enter, decreasing cardiac output. To compensate, the heart has to work even harder, creating a vicious cycle. Eventually, the heart can no longer keep up, leading to a condition called decompensated heart failure. So what now? We can actually break down what happens into 2 parts. On one hand, less cardiac output means that the organs aren't getting enough blood, and this causes organ dysfunction as well as Sarah's symptoms of fatigue and exercise intolerance. We call this forward failure. There's also backward failure, as blood backs up behind the failing ventricle, increasing pressure in the lungs that leads to pulmonary congestion, which manifests in respiratory symptoms, including Sarah's inability to sleep lying flat. In other words, fluid was literally building up in her lungs. In conclusion, this fictional case study is a reminder to stay on top of your health, since by the time you feel something is wrong, it may already be too late. Thanks for watching and follow for more.